Assalamu alaikum. My name is Harisha Tisham and my roll number is PB1650041 and my topic is Artesunate. Introduction. It is a derivative of artemisinin. It is a water-soluble ester of dihydroartemisinin. Now, rational use. What is the use of artesunate? Artesunate is a medication used to treat severe malaria. So it is anti-malarial drug. The intravenous form is preferred to quinine for severe malaria. Often it is used as part of combination therapy such as artesunate plus mefloquine. It is not used for the prevention of malaria. Now we have route of administration. Artesunate can be given IV, IM, but most preferred and suitable route of artesunate is IV. Doses can be given oral, IV, IM, and rectal. Oral 100 mg BD on day 1, 50 mg BD day 2 to day 5. Now, parenteral doses. In adult, 2.4 mg per kg administered IV at 0 hour, 12 hour, and 24 hours, and thereafter administered once until the patient is able to tolerate oral antimalarial therapy. Doses children under 20 kg. In children under 20 kg, 3 mg per kg administered IV at same as adult 0 hour, 12 hour, and 24 hour, and thereafter administered once daily until the patient is able to tolerate the oral anti-malarial therapy. Now we have mechanism of action of artesunate. Artesunate's compound have presence of endoperoxide bridge. Now, these endoperoxide bridge interact with heme and parasites. Now, heme iron cleaves this endoperoxide bridge. There is generation of highly reactive free radicals which damage parasite membrane by covalently binding to membrane protein. Drug interaction. Effect of other drugs on artesunate and dihydroartemisinin like ritonavir, revirapine, or strong UDP glucourinosyl-transferase UGT inducers. Now, DHA, a metabolite of artesunate, is a substrate of UDP glucourinosyl-transferase UGT 1A9 or 2B7. Ritonavir, nevirapine, or strong UGT inducers may reduce artesunate efficacy. Strong UGT inhibitors may increase DHA-associated adverse reactions. Concurrent administration of artemisinin with drug prolonged QT intervals like tricyclic antidepressant antiarrhythmics may increase the risk of cardiac conduction. Now cautions. Rare delayed post-artemisinin hemolytic anemia reported. Monitor for up to 4 weeks after treatment. Patient with higher Pestimas may be more prone to hemolytic anemia. What are the adverse effects of drug artesunate? Leukocytosis, hypersensitivity. In hypersensitivity, drug fever and itching. GIT, it is the most common adverse event or adverse effect of the artesunate. And GIT, nausea, vomiting, abdominal pain. ECG changes, STT changes, QT prolongations. The abnormal bleeding, dark urine, Rhinoclinocytopenia. Now we have alternative drugs. What are the alternative drugs of the artesunate? Minimum after 3 days of artesunate, patient able to take other oral medications like sulfadoxine, pyrimethamine, or mefloquine. Brands name Medisunate, Artesuel, and Mizonate. These are according to the prices, and at, prices are not mentioned as such. Now we have SOAP notes. The SOAP note is a method of documentation employed by healthcare providers to write out notes in a patient's chart. The four components of the SOAP notes are subjective. In this, we take notes of the patient's chest complaint and history. Subject Objective, in which the healthcare professional observe or measure the patient current status. Assessment, in which the condition is assessed and diagnosed. plan, in which a theoretical treatment plan is suggested based on diagnosis. Now we have case study. In case study, a 46 years old female without a significant past medical history presented to the emergency room in Liaquat National Hospital because of high-grade fever, body ache, and severe headache, chills and diarrhea for past 7 days, and in 2 to 4 days, fever was minimum. But after 4 days, fever get worsened and spiked to 104 at night with chills. Physical examination was normal and vital signs are also in limit, except initial WBCs, which is 12,000, which is high, and HP13, which is in range. Platelet count was low. And on examination or in CT scan, moderate splenomegaly was observed and peripheral smear for malaria parasite in CBC reflect trophozoites. Now, first we have subjective. In subjective, gender, age, chief complaint, and medical history comes. Gender, woman, age 46-year-olds. Patients complain. Patient suffering from high fever with chills and fever spiked at night, nausea, diarrhea, headache, body ache, and abdominal pain. Medical history. No medical or past history. Now we have objective. In objective, laboratory test comes. White blood cells, hemoglobin, platelets, MP test, and CT scan. White blood cells are 12,000, hemoglobin 13, platelets 1,11,000. MPT test reflect trophozoites. CT scan splenomegaly. Now assessment. According to the patient chef complaint and patient laboratory test, we can see that patient has increased level of WBCs, that is 12,000, and normal range is 4,000 to 11,000. And low platelets count and CT scan show splenomegaly and MT test show trophozoites. In blood, and patient has high temperature along with chills at night and abdominal pain. So the signs and symptoms show the patient suffering from the severe malaria. Now we have plan. As we know and as we diagnose that the patient is suffering from severe malaria, so we hospitalize the patient and give the drug artesunate, which is anti-malarial drug and given in severe malaria. So we give 3 doses of IV artesunate, that is 2.4 mg per kg per dose. And after when the condition will stable, so we switch the patient into another oral anti-malarial drug. And after some day, we will perform the test. Once it will comes negative, so we will repeat the test on the next day. And this test also comes negative. Other than that, patient must be protected from the mosquito bite, take fluids and avoid junks, heavy and spicy meals because of diarrhea and abdominal pain. References are Slideshare, Medscape, RxLates, and case study by ourselves. Now, thank you.